Welcome to the American Pharmacists Association Frontline Insights, a two-part interview series on rapid molecular strep testing in community pharmacies. This series is supported by an unrestricted educational grant from Abbott Laboratories. I'm Tana Kafer, pharmacist and director of clinical services at Bremo Pharmacies in Richmond, Virginia, and I will be your host. Today's interview will focus on the process of conducting rapid molecular testing for strep in community pharmacies, including workflow considerations, challenges with implementation and how they were overcome, training staff, billing, and so much more. At the conclusion of this program, we will have a live Q&A session, and in order to access this chat, you must be logged into your personal YouTube account, and I'll remind you of this again at the end. It is my pleasure to welcome Caitlin, used to be Pegum, now Yates. Caitlin just got married this past weekend, so congratulations. She's going to discuss best practices for implementing strep rapid molecular testing in her pharmacy located in an urban area of Iowa. Caitlin, can you introduce yourself and briefly describe your practice setting for us?
Yes, thank you, Tana, and thank you, APhA, for having me here today. My name is newly Caitlin Yates. I am the Director of Clinical Operations for Towncrest Pharmacy Corporation in Iowa, which serves 6 community-based pharmacies. My primary location and where I work as the pharmacy manager is at our Iowa City location, which is our most urban pharmacy.
And what inspired the decision to initiate strep point of care testing as a clinical service?
The decision to start strep point of care testing was pretty easy for us. We were doing a lot of COVID point of care testing during the pandemic, people wanting to travel, people wanting to get tested to start gathering again with their families. So we already had the framework in place to provide point of care testing. We already had a machine that allowed for additional tests to be ordered for strep. So it was very easy for us to just roll into strep point of care testing as well.
Yeah, that seems like a very, very good transition from COVID testing. So what were the key factors that influenced implementing strep point of care testing at your practice site?
Yes, so in the state of Iowa, we actually have a statewide protocol for flu and strep point of care testing and treatment. So that really laid the framework and the groundwork for us. Our state association and our board of pharmacy worked really hard to get that statewide protocol established and really went about it in a great way, providing what training do pharmacists and technicians need, what kind of testing can you offer, and then what does the treatment algorithm look like, and then what does that notification look like back to a patient's primary care provider. So really laid a great groundwork for us to be able to just jump right in and get started.
Yeah, that's awesome. With your experience doing COVID testing, then the test and treat protocol. So that's a great transition. So you mentioned that your practice setting is primarily urban. Can you tell me about the specific needs of your patient population?
Yes, so being in Iowa City, we are home to University of Iowa Healthcare, so a very large health system here in Iowa City. So lots of urgent cares, quick cares, emergency room options for our patients. But as most of us know from having visited some of these locations ourselves, can get pretty busy, especially during, peak cold and flu season. So our patients were really looking for a quicker option to get tested, to get treatment, kind of that one-stop shop, and get home so they could start feeling better. And we really advertise that we can do all of that within 30 minutes or less.
Yes, that's what makes this type of service in a community pharmacy so accessible to patients. And then what were the biggest workflow changes that needed to happen to integrate the strep point of care testing within your existing services?
The largest workflow change for us was following that statewide protocol. We had to have a CE accredited hands-on training to do the test and treat under that statewide protocol. So we had obviously been doing nasal swabs for COVID testing, but this was kind of switching to strep and doing a throat swab. And what does it look like to look in the back of someone's throat? And oh my goodness, we also need tongue depressors to be able to do this, and maybe a little flashlight. So just kind of changing the workflow based on that specific test for strep and making sure everyone got the training they needed, and we also had all of the equipment we needed as well.
Those are actually very good pearls that you shared about the tongue depressor, because I remember that too. It's not something you necessarily think about, but is very needed when you're trying to swab the back of someone's throat. And always fun to test on your fellow coworkers too. So there is appointment-based model, there's a walk-in model. What has worked best for your practice and why?
We heavily leverage the appointment based model within our practice already. So it was kind of a no brainer for us to also leverage this for point of care testing for strep. It was easy for us to create our kind of pre screening forms and get those loaded in our website, set availability for when we knew we would have pharmacist overlap. So we knew we would be able to have a pharmacist administer the test and prescribe treatment if necessary without putting too much of a burden on normal workflow. So it allows patients to fill out those pre-screening questions before arrival, allows us to also plan for which staff member is going to kind of be the champion for that specific test. And then we do still accept walk-ins if needed, knowing that if a patient comes into the pharmacy or gives us like a 5-minute heads up phone call, we could still always direct them back to the website to fill out those forms, either, the day before if they're feeling sick, or if they wake up that morning and they're like, wow, I think I really need to get tested for strep. Still being able to leverage the appointment-based model in both ways.
I'm a huge fan of the appointment-based model, and it allows you, as you mentioned, to meet the needs of your patients and also deliver on your promise of we're going to do this quicker than other places. So having the needed staff there. What major challenges did you face during implementation, and how did you overcome these challenges?
One of the major challenges for us was just lack of access to that CE program that I had mentioned for hands-on training. We worked really closely with our Iowa Pharmacy Association and Community Pharmacy Enhanced Services Network, or CPES, in Iowa to get a group of pharmacists together in the state, and they actually offered a session virtually through Zoom, which was very helpful to get hands-on training, because we know as pharmacists we're very busy. It's not always easy for us to step out of the pharmacy physically, but being able to jump on a Zoom call for an hour or two to get that hands-on training documented was very helpful. So just having more access to that was kind of a barrier for us, because they were a little limited in the sessions that they offered. And then also just getting the word out to our patients that we can offer this test. We didn't see as much uptick as we had liked to in the beginning, so I think that was another barrier for us as well.
All right, and how have you effectively marketed your strep point of care testing to both your patients and then also your providers if you're doing that as well?
So we try to have a pretty large presence on social media. One of our pharmacy owners is a big proponent of marketing and word of mouth. So, making posts and reels and videos just to get our patients engaged, and then also going the traditional route with bag stuffers for our patients that come in and visit the pharmacy, and just kind of planting the seed of, well, maybe they don't need the service today, but this fall when, they get sick or their kiddo gets sick, they're going to remember that Town Crest can do this for them.
And Caitlin, can you talk briefly about what your statewide protocol allows for children and kind of how you think you might want to work on that in the future?
Yeah, absolutely. So our statewide protocol allows us to test down to 6 years and older. And thank you for bringing this up, because this was also a barrier I forgot to mention. So specifically in our statewide protocol, if a child from the age 6 to 18 ends up testing negative for strep, we do have to refer them, according to our protocol, back to a primary care provider to get a throat culture. So really just kind of setting patients' expectations, setting parents' expectations, knowing that if their kiddo does test negative, it might be a trip back to the PCP anyways. When I first read that, I was like, well, there has to be a way that we can leverage this better in community pharmacy. So I dug into the literature between molecular antigen testing, and some of the molecular tests out there are so specific that they even say in their literature you don't need a backup culture. So that is something that I, again, relayed to our pharmacy association and the State Board of Pharmacy to hopefully look at in the future to make this a more convenient way for us not have to refer back to the PCP, which was kind of the goal in the first place, was to get, that one-stop shop altogether for our patients.
Yes, continuous quality improvement. When we know better, we do better, right?
Yeah.
So what essential training, and you kind of already touched on this a little bit, did your staff need to deliver the point of care services successfully?
So yes, I had mentioned the hands-on training, also infection control, which was outlined in our statewide protocol. And then it was really just making sure that every part of our team kind of understood their roles and where they fit into this, whether it was a technician assisting with sample collection or kind of triaging patients as they called in, whether it was a pharmacist that was also doing sample collection and maybe prescribing, or maybe it was a pharmacist who hadn't gone through the hands-on training, and how could they maybe be a part of the pre-screen for those patients. So just making sure everyone kind of knew their role and how they fit in, so that when we had that first patient walk through the door, that first patient sign up for an appointment, we were all ready to go.
That's awesome. And then how did you ensure compliance with the state laws and credentialing requirements as the program has continued?
So again, just referencing that continuous quality improvement, making sure there haven't been any updates to the statewide protocol. Again, relying heavily on our Iowa Pharmacy Association, our CPES in Iowa, and other pharmacies in the state that have been doing this test and treat, and really learning from them about the credentialing process. Being in a heavily urban area, especially in Iowa, only our state Medicaid recognizes us as providers. So that's kind of the one insurance that we have been trying to get credentialed with. And I feel like it's clear as mud sometimes about what we know. We don't know what we don't know. So we kind of leverage our state association and our independent pharmacy network to try and get some clarification on the credentialing process.
We're in the same boat in Virginia. We have provider status with Medicaid, and the credentialing process is the rate limiting step for sure. So now let's get into billing. Lots of pharmacists and probably a lot of our listeners are interested in this. So what billing or reimbursement challenges have you encountered, and how have you addressed them as this program has moved forward?
So for us specifically, again, being in Iowa where we're only providers with Medicaid, credentialing has been the rate limiting step, just making sure everyone has all of their training done so that they can get it submitted to Medicaid to be credentialed for this specific service. So we have taken a cash-based approach in our pharmacies. A lot of our patients, especially in Iowa City, we don't service a lot of that Medicaid population. A lot of our patients are older adults, so are on Medicare. So really looking at targeting those patients who have high deductible plans, or are just looking for that time savings and offering it as a cash-based service.
Yeah, that's certainly a savings when you think about going to an urgent care or an ER versus coming to a pharmacy and a copay, especially those that have high deductible plans. So that's a good strategy. What has been the financial impact or return on investment of offering Strep point of care testing in your pharmacy?
Yeah, I think this might be kind of surprising for listeners to hear me say, but I hope it kind of is just like, this is reality. It has been a very hard service for us to get off of the ground because of the barriers for payers in the state to recognize pharmacists. And then also when we rolled this out as a cash-based service, we unintentionally kind of priced ourselves out of, getting patients in the door. So we have since taken a step back and really evaluated the strengths of the program, the price point of the program, and re-rolling that out at a lower price point, still making sure we're getting paid for our time, getting paid for, the tests that we had to purchase. So it will be a great, still a great service to continue to offer in the future, but we really had to, we're at a head with where the service was going and had to reevaluate where we were at. So that is kind of my initial piece of advice to other listeners. Don't get discouraged if, the service doesn't take off right away. It's okay to kind of pause, think about how far you've come already, because you really have, with getting the workflow and policies and procedures in place, and then just kind of redeciding marketing and that price point to, do a re-rollout of the service.
Yes, we had a similar struggle in our pharmacy as well. Patients don't necessarily know, and they're used to going to urgent care. So it's almost like immunizations. Again, when we first started offering those, pharmacies do this, and now, of course, that's where everyone goes, right? So hopefully that the Strep point of care and the point of care testing in general will follow that trend. So, what key benefits have you observed for both patients and your practice since introducing the Strep point of care testing?
For our patients that have leveraged the service, it's great reviews from them just saying, wow, this is such a time savings. And I know the opportunity cost of saving time is such a hard concept for some people to understand. But I think the people who have been through the service and then relate it by word of mouth of like, oh, I'm going to tell my sister to come in because I know she needed a test too because we were just around each other, or something along those lines, has been really beneficial. And then also for our staff that has gone through the hands-on training, or feels comfortable discussing the service with patients, it just gives them a little more sense of pride in their job to be able to say, yes, we can do this, and they can kind of serve as that resource for our patients when they have questions about this service.
That's great. And so finally, what advice would you give to our listeners considering adding Strep point of care testing to their clinical services?
Definitely know and understand your state laws, and the credentialing process in your state, and deciding if you're going to go that route or the cash-based route. And then again, just don't get discouraged if, the service you don't get 100 patients in the first week, or even a handful of patients in the first week. Just knowing that you have that good foundation in place, so that way when you do have a patient come in, your staff knows exactly what they're supposed to do no matter when that first patient comes in. And that'll just be a huge benefit as the service starts to build.
That's awesome. Thank you so much. All right, that concludes the more formal part of the interview. And now we're going to open it up for question and answer from the audience. And just as a reminder, please make sure you're logged into your YouTube account to access this feature. And then let's see if we have any. So we have a question, Caitlin, can you post the statewide protocols for others to see as an example, or is it on your Board of Pharmacy website?
Yes, on the Iowa Board of Pharmacy website, the strep and flu point of care testing protocols are listed there.
Okay. And then let's see. Just a general statement. Were any, physicians in your area upset that pharmacists were doing this? And did you have to kind of explain yourself at all, or did that kind of work itself out?
Sure. So I forgot to mention this kind of on the marketing standpoint. We not only market it to our patients, but we did also make physicians in the area aware by sending them a fax letter, and did let them know it was per our statewide protocol. We did have, the training to be able to do these tests for, our mutual patients, and then also wanted to reassure them what information they would be getting back. Anytime a patient came in to, be tested, we would give them the results, positive or negative, and share kind of the pre-screening and also treatment if that was prescribed, right back with the physician as well. Because yes, healthcare doesn't need to be silos. We're all working together for a common goal, which is to make sure our patients are taken care of. So that's really how we tried to approach it with providers in the area.
Yeah, and keeping them in the loop. I tell patients all the time that call, well, we're going to talk to your provider too, because we want them to know. We don't want you to show up with information and they have no idea where you got this information. So always good to keep them in the loop. I don't see any more questions coming through. I'll give it a couple more seconds here. All right. Well, thank you all for joining. This concludes part 1 of our 2-part Frontline Insights interview series on rapid molecular testing in community pharmacies. I want to again thank Abbott Laboratories for sponsoring this interview and making it possible. And I want to thank you, Caitlin, for being here and giving us this information. And I also want to thank you, the listeners, for listening, and hope that you have found this useful. APHA recently published a two-part resource for pharmacists explaining the logistics of billing and credentialing for Strep test and treat services in community pharmacies. The first document, Credentialing and Billing for Strep Test and Treat Services in Community Pharmacies, discusses legislative authority, education and training requirements, billing and payment models, and credentialing and contracting with payers to deliver these services. The second document provides an overview of state-by-state pharmacist authority, information on payers, and additional resources for pharmacists who are considering implementing Strep test and treat services to reference. These resources are available at the URL that is posted on the screen. Lastly, keep an eye out for all the information coming from APHA. Again, we want to thank you for joining us, and I hope that you'll stay and join us for part 2 immediately after this of the Frontline Insights interview series to discuss best practices for implementing Strep rapid molecular testing in a rural pharmacy practice setting. For every pharmacist, for all of pharmacy, take care and have a great day.